Welcome to the 2022 Early Career Grants Application Guidance webinar. My name is Shrija Koiri and I'm the Grants Manager at the Royal Society of Tropical Medicine and Hygiene. The agenda for the webinar today is going to be as follows. I'm going to introduce the Early Career Grants Programme, give a bit of context to the programme itself. Then we will have a brief introduction about the organisation itself, explaining who we are, what we do, our aims and the activities we deliver. Then I will explain the eligibility criteria we have for the grants programme and the potential topics you can have the application on. And subsequently, I will run through the application form itself and talk through the sections that need further clarification. We also have a past awardee with us today at the webinar who will be joining us and talking through the application he did himself in 2019 and talk through his experience of applying for a grant with RSTMH. And lastly, I will briefly talk about the review process and explain how the applications are assessed and the timelines we have for the grants this year for successful applicants. And we will end with answering any questions that you may have. So to begin, the RSTMH Early Career Grants Programme is for early career researchers and global health professionals who are in the field of tropical medicine or global health. The grant awards up to $5,000 per award. The aim of the programme is to develop the next generation of global health researchers by providing seed funding to enable them to take on a one-year project of research in any area of tropical medicine or global health. Since 2017, the number of applications to our grants programme has increased exponentially from 163 to around 2,000 last year. Last year, every 1 in 6 applicants got awarded a grant. So in total, 202 grants were awarded to early career researchers from around 42 different countries around the world. Applications can be of any nationality, based anywhere in the world, and from a range of disciplines and sectors. Now, Taimar Ghosh, CEO of RSTMH, will introduce the organisation.
We were established back in 1907 in the UK, but despite being based in the UK, we are still global in all other aspects of our work. We are a membership body for those that are working in or interested in global health or tropical medicine. We're also a charity. We have over 1,800 members in more than 19 countries as it stands, but our network is far broader than that. We have around 20,000 people that are in contact with us regularly as researchers or as professionals during one of our activities, which I'll talk about in a second. And although we're only a small team of 8 people based in London, we have almost 1,000 volunteers. And it's in this way, with this amazing network, I'm sure some of you are here today, volunteers as well. It's with this help that we're able to reach so many people and do so much work. And then moving on to the next slide, just to look at what we aim to do and how we do it. So there at that top, you can see our, I guess, overarching goals. And like many of our institutions in this sector, we share the same sorts of ambition, and that's about saving lives. It's about eliminating disease and improving equity and access to health for everyone. The way we do this is threefold. First of all, we do what we can to support our members. Our strong belief is that our members' careers, if we can support them, will be the careers that then help them to achieve these big goals. They might be working on disease elimination or equity issues, or indeed designing the new diagnostics or drugs of the future. So investing in our members and in their careers, we think will help us to achieve that big goal. Moving on then to the second and third bullet point there, there are many ways also that we try and reach these big ideals. Partly it's about bringing together our members' views and experience and skills to try and help us identify what we could do better and how that will achieve one of these big goals. So for example, it might be that there's a policy activity that we need to do. It might be a research gap. It might be a funding gap. It might be that they ask us to call for and showcase a particular disease or a challenge that's blocking progress in one of the elimination goals or in equitable goals. So we rely on our members to tell us what we should be doing. And the third one there on this slide, we also, as an organisation that's been in the sector for many decades, we also have great networks. We have many partners. And through all of those relationships, we also have, from time to time, the ideas of what we can do to make progress towards those big goals. And again, that might be policy, funding, research, or even just showcasing, raising awareness of particular issues. So moving on now, just to think about our day-to-day activities. So this is what you'll see us doing, I guess, most regularly, if you're involved in RSTMH. The first is we publish 2 peer-reviewed scientific journals. Transactions, which is quite technical in nature, comes out every month. And International Health, which is a bit more policy-focused, is every 2 months. Now, in case we don't cover this a bit later on, please bear in mind these journals when you're thinking about applying for your early career grant. There are waivers and discounts available at our publisher for certain countries and authors from those countries. We also have the ability to also provide waivers if people make an appeal. And thirdly, our members get a discount to any open access fees that might be relevant to publishing in our journal. So please do think about them if you do receive a small grant and you consider publishing in a journal. And so moving on, we also have a network of many meetings and events with our partners and that we deliver ourselves. Obviously, recently, these have been mostly online on Zoom or on Teams, but as this year progresses, we're hoping we can do more and more of those face-to-face. So please do keep an eye on those. Thirdly, while we're all here today, we do provide early career grants for early career researchers. Last year, we provided a couple of hundred of those. So it's really good that you're going to be here on this webinar to hear about them and hopefully make your application or recommend others to make their application. We give out travel scholarships to attend our events. And again, this year, as we start to do more of our events face-to-face, we'll be opening up travel scholarship applications a bit later on in the year. And we also give out medals and awards to celebrate success in our sector, whether that be for those emerging leaders in their careers or whether that be those at very senior level in their careers. And we also support our members as much as we can through mentorship and training, often at our events, but we're going to try and do increasingly more activities on this online and in the members area. So the last thing I wanted to say is just that there are great ways, if you're not already linked to RSTMH, that you can find out about everything we do by signing up to our newsletter, which is on our website. Thanks again for joining, and I look forward to speaking to you later. Thank you.
Thank you, Tamar. In regards to eligibility, the main eligibility criteria for the Early Career Grants Programme is that grants are for early career researchers who have not received a research grant in their own name before, unless the total value received before was less than £5,000. RSTMH anticipates that most applicants will be at the start of their career, although we do recognise that there are some more experienced professionals that may be new to research, therefore they will also be eligible to apply for the early career grant. Similarly, previously unsuccessful applicants can also apply this year. Applicants who have received travel grants, they are also eligible. However, previous awardees who would not be eligible to apply this year. PhD or MSc students are also eligible to apply. However, the grant cannot fund the tuition fees. It can only fund the projects you may be doing for your course or your degree. In regards to topics, the grant applications can be on any area of tropical medicine or global health. Projects can undertake clinical or scientific research or fieldwork either as a standalone projects or distinct elements within a larger project. RSTMH's current strategy lists out its thematic priorities, which include neglected tropical diseases, malaria, snakebite, coronavirus, and climate change, as shown below. However, other areas of health that are less well known are also encouraged. So moving on to the application form, we would like to go through the application itself, go into our website and register. As it can be seen, the application window is only open until the 29th of April. So we have about a little more than a month left for application submissions. It begins by displaying the terms and conditions for the Early Career Grants Programme for this year. I would suggest having a read through this text before you begin your application. The application form begins with gathering your personal details, which we won't go into much detail today as it is pretty self-explanatory. The form asks if you are a member of RSTMH. This question is for our own data collection, so please do not be deterred by this. Applications can be submitted from non-members. However, if you are successful, awardees must join RSTMH before the funding is supplied. So in this instance, if you are funded by one of our partners, the membership fee will be paid over and above the grant by them. However, if you are funded by RSTMH, it will be deducted from the grant itself. Following that, we ask for personal email address. This is used for all communications relating to your application. And if successful an award, it needs to be valid for 2 years. Moving down, we inquire about your professional recognition or any key achievements that you have. This is not a compulsory section, but if you do have any prizes, medals, awards, or honors that you have won so far in your career, you can list them here and let us know about it. We are keen to hear from you on how you consider yourself an early career researcher. RSTMH does not use a definition focused on specific roles, qualifications held, or age to define who an early career researcher is. Instead, we choose to supply guidance around the profile of an applicant who may be suitable for the grant. So please do have a look through our guidance that is provided on the website, as well as on the terms and conditions above, and let us know how you feel that you're an early career researcher. Applicants should meet this profile and should not have received research funding in their own name before, as previously mentioned. And the applicant's supervisor must be able to verify this as part of their reference and the application process. If you look through the application form, there are these prompts in grey in the form that provide a bit more detail about the questions that may also be helpful as you're going through the questions. There are only a few sections that have word limits. So for instance, the title of the project is limited to 20 words, and it must be clear, descriptive, and concise. If you could also let us know the disease area or the main health area that you'll be covering, such as if it's malaria, mycetoma, or snakebite. Scrolling down further, we ask for a non-technical description, which is limited to 100 words. This section, please provide a summary of your project for people who are not familiar with your project. In terms of project start and end date, the research project should ideally start between September and December 2022, so this year, after the planned payments date, which is currently estimated to be in September this year. The project should be completed within a year. And if you're not able to deliver your project or report to these timings, then please do consider whether you should apply this year. We also inquire about the extent of laboratory use in your research project. So please do tick the option that is most applicable to your project. Further moving down, the detailed project statement is the section where you will explain the actual body of your research project. This is the section to detail your project background, the needs you are addressing, why do you want to carry out this work, any context to this piece of work you feel we should know. It should describe the key questions your project is trying to address. If possible, this should be written as a research question or hypothesis to be answered through your project. Please include the methods you're intending to use in this research, how you will analyze it and draw conclusions. please do ensure to explain the impact of research outputs on how you're intending to improve the health and the research community, the expected outcomes, as well as describing exactly what your role is in this project and how much of the work you will do yourself. This section is limited to 1,500 words. Moving down, we have a section for you to include your references that is cited in the project statement above. This is limited to 1,000 words. As you can see, it is not a compulsory section. However, if you were to include references, please provide them in accordance to the style of the Royal Society of Tropical Medicine and Hygiene and the Oxford SciMed referencing style, following the instructions and the examples that is provided in the section below in grey. Next, we have the project budget. The application form has a table requesting details on what the budget item is, the amount you require for it, and if you could provide a brief rationale or reasoning as to why you require that particular budget item. We have a list of eligible and ineligible costs stated in the terms and conditions, as well as in the form itself below the section. Certain costs have been capped either at 20 or 50% of the overall budget, and that includes costs for international travel, equipment costs, if you're purchasing computers, phones, or ethical approval costs. So please do have a read through the list beforehand. We do understand there may be exceptions to this guidance and would ask applicants to demonstrate the evidence to demonstrate the evidence for the need of these higher costs as part of their budget. Next, we would like to know the stages of the progress you aim to have during your grant period. We have divided these stages into quarters from March to December. So please do let us know which stage you envision to be at by those months, and if there are any challenges that you foresee that can hinder the progression of those very stages. Following down, we would like to know if there are other funding applications that you have submitted for this piece of research. So if this grant application is part of a larger research program, the match funding must be in place at the time of submission. In addition, applicants must also include a brief outline of the larger research program's budget in this application. Please tell us how you're carrying out this project and how it would help progress your career. We're really keen to know the impact this grant would have on your research career. So please do let us know. There's an open text box at the end of the application form, and it's limited to 200 words, and you can let us know how this grant would enable you to further progress in your research career. And this can include progressions to new roles or additional funding that you may secure, as well as describing any new skills, networks, or experiences you will obtain via this grant. Lastly, referees. This is an important section as the application must be supported by 2 referees, one of which should be a direct supervisor for this project, and the second being a senior member of the employing or affiliated organization. The references must be on headed paper and must be complete and uploaded to submittable by the deadline, that is 29th of April at 5 p.m. GMT. Applications without submitted references from both referees will be considered incomplete and won't be assessed. Referees should use an institutional email address and not a personal email address to submit their reference. However, if that is not possible, and a personal email can be used as long as a justification is provided. When it gets down to submitting your application, please do make sure that your referees will not be emailed until you click apply button in submittable. So applicants themselves are responsible for ensuring their referees submit references directly to submittable by the closing date, preferably before the closing date. And again, applications without 2 complete references submitted by the deadline date will not be considered. Now I'm delighted to introduce our past awardee, Dr. Adabi Adinaran, who was a grant awardee in 2019. He's kindly talking us through his application form and talking through his approach and any top tips he has in writing a project statement, project budget for an early career grant application.
So the application I submitted was actually a sub-objective of my PhD thesis at the time. I've actually tried unsuccessfully for a couple of times to get funding to actually fund this aspect of the study, because I actually had the sample, some of the sample collection done and had initial data. So basically the study was about surveying arboviruses and chikungunya virus in particular in mosquito population along the Mexico-US border. So to address some of the critical part of the questions that are in the application form, and I want to look at my background. In the application form that I submitted then, there was a limit to the number of words that you can submit. So I think that is a particular attention. You need to put that in mind when you are developing your proposal, and ensure that you are able to fit in critical information about your proposal within the word limit. So in your proposal, you want to have the background. You want to provide as succinctly as possible all information that will be particularly give a detailed background of why you are doing the research. In my own study, I try to give a background of chikungunya and how it has been of public health importance in Mexico, and why we are doing the research, and then why we are doing it along the border based on evidence of reported cases at the other side of the border, which is the United States. We were on the downside, and then we have information from the Secretariat de Salud that there has been history of traveler coming down from southern Mexico up north, because Reynosa was up north, and then people trying to want to enter the United States. So you want to provide that detailed information as much as possible. And then you try to identify the knowledge gap, which is the questions that you are trying to answer with your research, with your proposal. So these are like, you want to highlight that, and then you want to, within that 1,005 word limits that you have, you want to have these presented to the reviewer. So that is on the background. You understand the background, this 1,005 word, it also includes your aim and then your research question. So everything, the background and the context is 1,500. So you want to, like, for my own application, so you want to have everything, and then you want to be still within that word limit. So for my own aim, I have it as one sentence. And then for my research question, I make it as short as possible. I have only 2 research questions, so that it is everything that I'm trying to do is clear. What is the infection rate of chikungunya virus in mosquito population in Reynosa? Like, you want to use the approach of what we call the SMART objective, as much as the SMART objective as much as possible. And then you have what species of mosquitoes are involved in chikungunya virus transmission in Reynosa, Tamaulipas. So those are the 2 research questions that I have. The project design. And the project design, you want to describe the methodology and how you're going to apply for your study, how you're going to do it. Like, you want it to be detailed, where the study is going to be conducted. If you are collecting sample, how is the sample collection going to be done? If your sample involve human, and then you need ethical clearance, you want to put that into it, how you're going to go about your ethical clearance. If you want to, like, if your sample require maintaining cold chain or preservation of sample while on the field, you want to put that as much detail as as much as possible. What are the method and then the reagent that you're going to use. I think some of the things that I did was that every of the methodology that I put in here, I ensured that the detailed methodology that I provided, I align it with my budget, because you will want to put something in your budget that doesn't align with your objective. So that what you are doing, what you're saying you want the funding support for, like, okay, you want this, you want it to reflect in the methodology of your proposal. Like you said, you want to analyze, let's say you want to do PCR. Okay, then if you have your budget that you want to buy PCR kits, so like what you are doing is relating with your budget. So your study design part of your work has to be in line with what you are requesting the support for. Like you want to provide that information, even though you know what you're doing, but you want to provide that information so that the evaluator, the assessor can actually understand what you want and then what you want to use it for. And then I think another part, another significant part that you want to highlight is how do you want to make this, how impactful is your study? What is your approach to, how do you aim to maximize the impact? And for my own study, got some of the background in my introduction were information that we got from the Secretaría de Salud, which is the equivalent of the Ministry of Health in Mexico. So my approach to the study is that it is a research study, and then the people are the ones that are infected. It's like it is a human research, so you're going to the community. So I work in line with the health officials, get the background information, try to understand what is the challenge that they are faced, and then being a researcher, trying to assess what are the current transmission in the population around that place. And then when you get the research permission, when you get your research finding, also disseminate this to them. And unfortunately, when we even did research, by the time we want to even analyze the sample, some of the sample were actually analyzed together with Minister of Health officials, because that will happen. Unfortunately for us, these research, by the time we want to implement it, was during the COVID lockdown, and then and then there was a kind of challenge. So, but then because of established communication we already had with them, relationship we already had with them prior to the beginning of even at the development of the proposal. So we're able to just implement it together while they are doing the surveillance for testing for COVID. So it makes it a lot easier, and then be able to understand what is happening. So you want to actually try to highlight how with this research, how will it improve what is currently existing in terms of the community, because when there's a reported outbreak, are able to generate information that also public health officials to understand where they are to focus on and what they are to work with. So I think the impact of the research is also something that you want to give emphasis on. Also, on the expected outcome, even though, research, you can always anticipate what you want. Like when you have your question, you can actually know what is it that you want to your result outcome to look like. So for my unexpected outcome for my research, I was expecting updated information on infection rate of chikungunya virus in mosquito population in Reynosa. Even though at the conclusion of the study, what we found was the dengue, because we then we look for chikungunya and then because we some challenges might come up during the project, which include like COVID, and then you're unable to sample as much as you want, but you have no control over that. But there are some things that you want an updated information on infection rate of chikungunya virus in the mosquito population. You also want to know which of the vector vertebrates are actually involved in transmission of infection. That like those are part of your question. Like if you want to know, is it Aedes aegypti? How much of it Aedes albopictus is involved in the infection? So or something else that according to your research question that might likely come up, it's like what you are anticipating essentially, like you might likely get. So those are what is you are expected to put in the expected outcome. And then because it is a research study, and then you are not likely to do it alone, you're most likely, you are not likely to do everything by yourself. You want to highlight also your role in the project. For my study, because like I said earlier, it was part of a PhD, my PhD thesis, and then I'm not all by myself. I have my supervisor and my advisor with me. So my advisor, and they also happen to be my referee for the application. They were along with me during the there was the discussion with us during the development of the proposal. So I carry them along as much as possible. But because this is my PhD thesis, I was heavily involved in the data collection, the processing and analysis, and even the laboratory work, of this all the feeder collection of the mosquito, the design, and then the coordination of the field activity. Even though I had the support of some of the other my colleague in the lab, master students, because I was a foreigner in Mexico. Definitely, I needed the local support of the people because some of the language barrier, and then I can't just walk into communities in Reynosa, Mexico, and then for mosquitoes. So you need the support for them, but at the same time, you want to highlight what is the actual activity that you will be carrying out in the execution and delivering of the project. So so you want to highlight that and make that clear. On project budget, I think because it's a small grant, it's not a big amount of money. My budget was actually focused, and it is a molecular study because I want to survey for virus. Then I think my most of my budget was like my budget was essentially focused on reagent, like the material consumables, and then of course, and I think there was a little minimal support for the feed towards the feed expenses, but it depends on how your study, your proposal might look like. But your budget, you want it to like at least it address a critical part of some of the questions that you want to you raised, because for my study as well, like for instance, I wanted to collect mosquitoes, and then from that mosquito, I want to examine whether those mosquitoes, whether they have virus or not. So my budget was like now towards the feed expenses, a very minimal part of it towards the feed expense of collecting the mosquitoes. Of course, I already have the lab, some of the big equipment like the microscope for the identification of the mosquito and all those. So that is not included in the budget. But my budget was essentially for the feed work, and then for buying the reagent for the care, the kits, the kit that was used, and then the medium, the PCR and the PCR reagents, like the primer, and then the probes that was used, and then the purification kit. And then because we anticipated if we get positive controls, we get positive pools, where I likely want to sequence, and then the cost of sequencing. So I put that, and then we sequence that commercial sequencing facility. So we put that into, also factor that in. So that is on the budget. And then also, I don't know, it depends on the what is applicable in your country where you are applying from, but you want to put some provision for VAT, because some of these purchases that you're going to be making will also contain VAT. And then you want to estimate that into your budget as well, so that you don't fall short. So I also have that into factor into the application. I think that will be that on the core part of the application. But there are also some questions that you need to answer as part of the application process, which will be like, what will be the, you have mentioned like, what is the impact of this on the community? Though you also want to like, what is the impact of, what will be the impact of this career, of this research on your career? Like, how important is this research to you? So you want to, I want to put that like, and then make like kind of appeal, like for in your proposal as well. For me, I was in the third year of my PhD then, like, and I want to like, it is important for me to finish my PhD on time, and then within the time I like the academic, and then this is an academic output for me. And then there are some of the aspects of my PhD that has been answered, and then I need it because my PhD is around surveillance and entomology. I've done some other parts that involve identification of mosquito in some other places, but there is this part that I haven't been able to go through. So I try to highlight that because like having a PhD is very important. Like completing that study is also important for me. So I highlighted that, and then of course the skills that the entire process we exposed me to, which include, discussing with officials from the Ministry of Health, and then discussing with your supervisor, and then managing the entire project itself, and then the laboratory skills, and when you are trying to examine virus and mosquitoes, and then all those, and the technical skills that you gain from that. I think those are necessary skills for me that I think I should have at the end of my conclusion, at the conclusion of my study. And I think looking back now, I think that has really greatly helped me a lot, because in my current role as a technical advisor for NTDA and entomological and diagnostic capacity building, like it has largely been something like a kind of a skill transfer, because right now I'm trying to look at I'm doing like something similar, but no, I'm not looking at virus, and I'm looking at diagnostics of neglected tropical disease. And I like looking at if countries have, and I'm still working with Ministry of Health that covers about 15 African countries. The country wants to do surveillance program. You want to look at, okay, what are the diagnostics that they're going to use? You want to look at, okay, we are planning the diagnostic surveys. What are the laboratory resources? What are the items? You want to ensure that everything is in place, and then you train them. And then some of these are actually applicable, because like, for instance, for onchocerciasis now, that is diagnosed with O150 PCR, OV16 ELISA, which are some of the skills that were actually picked up doing this, implementing the study. So like I can say the grant has actually helped me a lot, because it enabled me to complete my PhD on time, and I think I would say it contributed largely to me finishing that PhD with cum laude, because that I was awarded cum laude for my for the doctoral study, which I think is it's good. And then also helped me like in my current position, because some of the experiences that I was able to develop doing the implementing the research were like actually transferred here. So I like, and then because of even some challenges that we encountered, I think, in the implementation of the research, because then COVID came in, and then you have to like, this is a new situation that you didn't imagine that come on board, and then you are trying to like problem solving skills, and then you still have to deliver on the project, like you communicating with the donor and giving them update on what is happening, and all of that. So, like, those are some kind of skills that that is like a project management, and like I wouldn't have had the opportunity to have if I'm not the one managing and responsible for the grant. So I think largely the grant has really catalyzed, like helped me a lot in terms of my research career, and then where I am today, because like the title of the proposal was entomolecular epidemiologic survey of chikungunya virus in Mexico US border community. And my current position today is also like technical advisor into the diagnostics into the entomological and diagnostic capacity building. Like it's more or less like from the research to my current position, and then supporting programs also having the similar impact. And like it has really been great. And then from my PhD, I've been able to have 3 publications from my PhD study, not as some data from this research are definitely part of that. The entire body of work from this, because I completed that project, and then I transitioned to completed that phase of my chapter of my PhD, and then because of COVID and everything, and then transitioned to this phase, and then so the entire body of work is not out yet, is under preparation. But yeah, I think the grant and on the whole has really contributed to my to my career. Any top tips? I think one of the top tips is about, I would say, is about looking at the application and then trying to follow the guideline as much as possible, trying to I think the word limit, I think is very, very important for me. I think some of that for me, and because the word limit, I think it enabled me to be succinct as possible in terms of my word, how I frame sentences to convey the information that I'm trying to pass that across. I think that is the, and then like I said, you want the methodology and then your budget, you want it to align. Like what you are requesting for the fund, you want it to align with what the question you are trying to answer in the research. Like you're not trying to buy some, use the fund to do something else that is not related to the research. I think that is the top. That would be like the top tip from me.
That was really, really helpful for our potential applicants. Thank you again. So in terms of the review process, and once you've submitted your application, all the references are in and you've clicked that apply button in submittable, the review process here at RSTMH is such that applications are assessed by our global assessors, who are a group of around 50 global experts in tropical medicine and global health. Their expertise ranges from medicine, academic research, to public health, health economics, humanities, etc. They will assess your application on a list of criteria, such as the importance of the proposed research, the quality of your methodology and project design, the proposed research's feasibility, its impact in the field of tropical medicine and global health. They will also seek to understand if you have sufficient availability of mentoring and support around you to enable you to complete your research project. And lastly, they will also assess if your project is good value for money. So compare your research project against the budget that you would have proposed. In terms of timeline, so this is the timeline for our program this year. So as previously mentioned, the applications are currently open. If you'd like to submit, they close on the 29th of April, 5 p.m. GMT time. If you are successful and awarded a grant, the payments are currently being estimated to be paid out around September. The project should ideally start by December this year. And then you have a year to complete your project. We require a final report from awardees after they've completed the project, and this should ideally be submitted by March 2024. Thank you for listening. Please do let us know if you have any follow-up questions for us for the Early Career Grants Program. Thank you.
Some actually in that I've seen some coming in. I've been trying to keep up, as I know have others, Amelia and Ella and Shrija and Atabi, be trying to answer as many as we can in the Q&A. I know there are lots of questions. 175 still standing. I have suggested some that I've seen that I thought would be good to answer live. I don't know if you can see that. Atabi, there was one I think for you around the fact that you'd applied a few times before you got your award. And I think someone was asking whether it was the same project or a different project. So apologies if I've got that wrong, but I think that was one of the ones I thought we could do live with you answering.
It was, I think, the second and the last one before I got the application was the same project. I think my initial applications went the same. But it wasn't like I just take up a previous application, like the proposal as it were, and then just resubmitted it like that. Of course, like I said in the earlier, you know, there have been like new information, like new data that you have, and then you want to like rework that like to make it, and then based on new data. So it is still part of my PhD project, but it is not like entirely the same, like word for word, like my previous application. So like the entire, you can say the objective and then the question, like the second and the last application that was later funded. I can say maybe I sure had a notable difference between the application that was funded and then the last one I submitted was the writing of my background, because I can remember that in the application that was funded, when I was writing the background of the study, I put in some references, like, you know, in the online platform, there wasn't, I was trying to like work within the word limit. So I didn't put, I think I didn't put in the references to some statements. You know, in science, if you are making some claim, you want to back it up with a reference. So, and because of course, the structure of the application process doesn't specifically create a section for references in their application then. So perhaps in my earlier application, I didn't put that into consideration. But in the last application that I submitted, I think putting that references to that, some of the claims that were made as a background to the study, I think also could have helped with the assessor. I don't know. Right. I think that also is a major distinction.
I don't know if you wanted to pick up some of the questions that you can see in the Q&A. I don't know, there are so many, I was struggling to see them all, but if you see one that's easy to answer and might help a few people, then please do. Yeah. And Atabi, I'll try to find the ones that you could answer. Well, we've got you here as our past awardee.
I'm seeing this one now, that if a project on capacity strengthening within global health research can be supported. I would say, yeah, because from my experience of colleagues that everything that we are doing is also mostly, if you are research, is towards strengthening. So I think capacity strengthening can also be supported, because from my own experience with the research I did with the Ministry of Health officials, like there will definitely be some transfer of knowledge from us in the lab, which is a research institute to them. So yeah, I would just say yes. But on a whole, I think for applications, you don't want to like have a doubt in terms of submitting of application, like whether these will be accepted or not. You can just put in the application, and then since that I think the instruction has been there, some of the lines, and then some of the areas, since if it's still within the global health and then tropical disease, I think so far within the scope of RSTMH generally, I think you should just go ahead and submit your application.
I can see one, Shrija, I can pick up if that's useful. A couple of people have asked it in different ways, so I won't be able to find the exact wording now, but it's a question about feedback to applicants that are not successful. So it's just to say that unfortunately we're not able to provide feedback to applicants, and that's because of the sheer volume of applications that we receive every year. And because we have a group of volunteers who are assessing the applications in terms of quality, to be able to get through all of the applications in the time that we have allowed and be able to then pay out the awards in also within a few months, we're not able to provide the level of feedback that would be useful. So I'm sorry to say that we don't do that. If that is really important to you, then I would consider whether you would like to apply, because it is something that's likely to stay the same for a little while until we really change the capacity of our assessors and the numbers of applications we get in, so they have more time available. It's not something that they'll be able to do, and we do try and prioritize their time to be able to look at as many applications as we can, and so far we've been able to do that, but it does get more difficult each year with those. So yeah, apologies for that. I know that covers a few people.
Go for it.
Okay, sorry for interrupting. I think I've seen some question around reference. Who can be your reference? I think if you are a student, I think your supervisor, you definitely, especially if you are a graduate student, you definitely have an advisor. I think it is best if your advisor can be one of your referee, and then if you are a student as well, you actually be in a department, and then you have maybe, I don't know how it operates in the country the applicant is from, but I think generally there is always a head of the lab or of the team or head of the department who can be like be your second referee. So I think that should answer the question of on who can be your referee. And I think somebody also said is not employed about employment. I think most of the applicants that I know, that even myself when I was applying, I was successful. I wasn't employed, I was just a student as well. And I actually know a couple of other people, grantees, that are actually also a student. So I think if you are a student, it's not necessarily like you have a kind of a tenure or being a faculty member in a university before you can apply. You can apply as a student.
I've been seeing a lot of questions on topics. So is cholera eligible? Is TB eligible? And as previously mentioned, any application on global health is eligible. It doesn't have to be restricted to a disease area. It can be any global health issue that you want to explore and do a research project on.
So there's a couple of questions around multiple applications. So this is relevant to a few people. So unfortunately, you can only submit one application per year. I guess you can technically submit more than one, but we'll ask you to choose, and we'll only be able to put one through for assessment. So one per person per year. Thanks.
Just saw another question that asks if there is a time limit for references to be on the platform. Not a specific time frame, just as long as it's before the deadline, it will be included.
The question that keeps coming up is around multiple applicants. So this has come up as questions around, can a pair apply together? Can a group apply? And can an institution apply? So this point is really clear, really. Our grants are for individuals because partly they're about career development, and part of the assessment of the grant application form is about assessing you as an individual and how this award will help you in your career, and whether the assessors feel that you're in the right position to deliver this project. So in that sense, the award is for one person, and the project should be what that one person is carrying out. And similarly, the payment, the award that's made is to that one individual as well. So to your own bank account. It's important that we are able to pay the award to you individually. I know that there are a few countries in the world where that is difficult from a regulatory and legal perspective, in which case you should have a chat with us and we can help understand what we could do if you were to be awarded. Question for you, Adbi, sorry. My question is, please, can Dr. B help us to explain more on the question in the application? Explain how you consider yourself to meet the profile of an early career researcher.
Okay. Thank you. I think I feel the profile of an early career researcher because at the time as I was applying, I was a PhD student. I don't have any I don't have any previous grant to my name, and I started my PhD study at the back of completing my master's study as well. And then even at the completion of your PhD, the first years of your starting out, if you are in the academic and in the academia, you're still an early career researcher as far as I'm concerned. The general knowledge for early career researcher people mostly that are not non-tenured, and then maybe still less than generally 5-6 years into their academic journey. So that's it. And you are not the head of a lab. You don't have a research team like with big grant to your name. That is my understanding of early career research. Like you haven't supervised a PhD student to completion. So I think you still fall into an early career researcher.
Another question, Shrija, if you want me to pick up. I've just lost it now. Where's it gone? They keep jumping around. It was about rejections and top tips. So this is a really interesting question, and given that I've just said that we don't provide feedback, if you have a really good look at the terms and conditions, we tell you really clearly how your application will be assessed. So what the criteria are that our assessors look for. And Shrija talked through those just a little bit before when she talked about assessment. So I guess the biggest tip I could give, and maybe Awardee can contribute to this answer as well, is be really clear that you read through the terms and conditions and you know how on what grounds your application will be reviewed. So think about, for example, that you're defining the problem that you're solving really clearly. Think about how you're putting forward the methodology, how you're going to address that problem, and how your research will do that. And think about explaining some of the areas that the criteria is looking at. So for example, how is your budget feasible? How will this contribute to your field of work? How will it impact your career? Those questions are really important to make sure that you cover in some way, because it gives the assessor a really good understanding then of how you're going to deliver this problem and hopefully come up with some really good outcomes. Awardee, did you want to add anything to that, given your experience?
Yeah, like I think you have captured most of it. You want to be as clear as possible, and I think also there's this part of the application that asks you to give a summary of everything in non-technical terms. I think that is also a part that you want to consider, because you want the you want to explain your research, your objective as clear, like as unambiguous as possible. Like you don't necessarily have to use big on technical terms in the proposal that will be difficult for the ordinary person to understand. So just being clear and being straightforward, I think is very important. Like make it very not simple, like not simple in the sense of 1+1, but then like you don't want it to be unnecessarily complicated, because it's a small grant, and then you don't want to say you want to answer a question that like is complex as that it will be not feasible for the grant to successfully implement.
Questions that I've been seeing popping up a fair few times is about being a student. So you don't necessarily have to be a student. If you are a professional in the medical field or any other field and want to apply, you're still eligible. You do not have to be a student for it.
Credentials of the referees are considered. I don't think so. You are just going to provide the name and then the contact of your referee. I think the referee will be contacted directly by RSTMH. So you will not want to put in the name and contact details of someone that you have not previously discussed the application with, and like you want to let the person to be aware and to be on the lookout for the communication from RSTMH on your behalf. And then you also want to like follow up to ensure that the person actually responds to that before the deadline, because I think there is a deadline for which your referee have to put in the reference on your behalf, and then you want to also follow up with them. You don't want and then you want to ensure that that has actually done. I think it's also a critical part of the application. You don't want to just put the name or reference of someone that you have not been in communication with, or that you have not previously discussed the work or the project with together. I think it is always very good if it is someone that that is going to be actively involved in the project, even though you are the one that is leading. But if it is somebody that will actually understand the project and why you are doing it, I think it is always an added advantage.
That we missed out today, please do send me an email and I'll do my best to get back to you. A question about age limit. We do not have any age limit for this. If you are at the start of your research career, you're eligible to apply.
Sorry, my answers are now reverting to single words just to get through as many as, I don't know if others are doing that, but I'm sorry, they're
yes,
a bit
I'm
short.
doing that. Yeah, I think providing those actually is better. For like, I can be reached. Can also reach out if you want any further have any further question that might not be answered here, like said to me. I think on social media, I'll try as much as possible to be able to get back to them, because quite busy as well. But then you can try. I'm available on Twitter and then on LinkedIn with my name, DB Adena. You can just search for me and send me a DM. I can I'll try as much as possible to answer the question. There's no age limit. I think that has been answered a lot. Somebody said, I'm a Canadian, I living in Sierra Leone.
Someone asked if we can display the deadlines, the timelines. I think timelines have come up a couple of times. Don't know if you're able to put that up in the screen. That would be really good for a few people. And we will put our email addresses in the Q&A for you, so you can see those. A question about supervisors keeps coming up. Your supervisor doesn't have to be based where you're based necessarily, as long as they are supervising for the whole of your project term, that they don't have to be in your institution or even indeed in your country. The second referee, though, unfortunately, does have to be in your institution.
I think also I think there has been question around if a single supervisor can supervise multiple students, and I think that is possible. If the supervisor can have be a reference for a number of applicants for the project.
They can, and indeed we do have that some years. Obviously, if it gets to too many, we just want to be really sure that the supervisor is providing that support to our awardees. But yes, we do have the same person on a couple of grants sometimes. Are you able to put your email address where people can find it? There's a few people asking.
Yeah.
I think, I don't know, maybe Tama, you might want to address that. There's been a couple of questions about retrospective proposal. Like, do you consider retrospective proposal? I think you might want to talk to that. And then some people also asking if they could, they can start the project ahead of being, of getting maybe feedback if the project is successful or not.
So we don't fund retrospective studies. This is for new projects that you want to start to do, and the project should start within 3 months of being of receiving your funds. So in the timeline that we had up just now, that's between September and December of 2022. So to be eligible, your project needs to be starting in that kind of time frame. I am aware that for some that doesn't work seasonally. That might not work in other ways, but unfortunately we have to try and structure the year in some way, and so that's what we've looked at. Qualitative research is, if you're not part of an organization, that's come up a couple of times. We do, in the terms and conditions, it does say that we would like you to be. That organization doesn't have to be an academic organization or a research organization. It could be an NGO, it could be part of a startup, for example, or hospital or any other organization. And the reason for that is we do need a reference from a senior member of the organization, and also a supervisor who is normally linked to you quite closely in your area of work. If you don't have an organization, then the best thing to do is to drop an email to us, and we can have a look at your individual circumstances and get back to you. They can't be co-investigators, unfortunately, just seeing one of the questions there. These grants are for individuals, so it's one person doing one project, and we're supporting the career. So part of the assessment is looking at you as an individual.
There's a question about if the funds can be used to sponsor an objective of an already funded grant. So I'm afraid we can't duplicate funds. If it's a project that is part of a larger grant, you'd have to let us know what, if you've got the match funding and what they're funding and what we're funding, because we won't be able to duplicate any funding.
There's a question about institutional emails. The reason why we ask for institutional emails for references is that it forms part of our due diligence that we need to do for ourselves and also for our donors. So that's why we ask that the references that you provide are with emails of the institution where they're based.
I've seen a couple of questions about fellowships and PhD funding, and if they count as receiving funding in your own name. It depends on what the fellowship or the PhD funding covers, and if they do cover funding for you to be able to do a research project, and if that funding is above £5,000, then you would be ineligible. But if it covers tuition fees and other areas of your PhD or your fellowship, then you'd still be eligible.
I think somebody answered if asked that if can sample be collected in one country and part of the grant used to analyze the molecular aspect of it in another country. Well, I think my answer to that would be yes, but still, if it's for me, it is a still single straight project. Like maybe there is no laboratory support in the country where you collected your sample, and then if the sample is the budget is just to maybe procure reagent that will be used to analyze the same sample, I think there will not be any challenge with that. Of course, you have supporting document from the lab or where the sample is going to be processed, and then your supervisor is also aware of that. So
about if members have more chance of getting funded than non-members. That is not the case. Everybody has an equal chance, and membership is just a data that we collect, and if you are awarded, you'd become a member of RSTMH anyway, so there will be no favouring to members compared to non-members.
There are a few questions coming up about the type of students that can apply. There's some questions about medical students, undergrad students, MSc students, PhD students. So just to say, there's no, we don't preclude anyone from applying. As Shrija mentioned earlier, often it is people that are master's students and beyond in terms of experience, but it doesn't mean that you're not able to make an application if you would like to. If you have a clear project and you feel that you have the support to achieve it, then you should put your application in. And if you have any questions, please just send them to us and we can have a look at your individual circumstances. There's a question about funding actually as well that I'll answer. Oh, it's just jumped. I think it was about if the project costs more than £5,000, can you still apply? So we are unable to provide an award that's greater than £5,000, but we do have people apply sometimes where there's a distinct element within a wider project which costs £5,000 or less, and they apply to us for that, and they apply to others for other elements of that wider project. Which is fine. Just let us know if you're going ahead is dependent on that other award. We also do have people sometimes that apply for an award with us at the same time as an award from somebody else. Again, as long as we know, we can't double fund, as Shrija mentioned. So if you've got a few different award applications out there, just let us know if any others are successful, and we'll ask you then to just withdraw your one with us. The supervisor doesn't have to be a professor. And maternal and child health is within the scope of the programme. No, multiple students can't apply on one project. It is one person, one project. Sorry, just trying to get through the short ones that are at the end. So I guess we're at time now. Shrija, I don't know if you wanted to say anything. I just had a couple of points to make, but did you want to start the wrap up?
Yeah, as previously mentioned, the recording will be available, and the recording, once it's all edited and ready, will be sent out to all the attendees, but it will also be available either on the website or our YouTube channel. And if you have any questions, my email address is on the website. Please do send it my way. Yeah, Atema.
Yes, I was just going to say thank you so much for joining. And if you are on the call, not because you're applying yourself, but because you work with many other early career researchers or others, then please do tell them about the programme. Please do help us spread the word on social media or through your institutions or organisations and your own personal networks. We really want to help as many people as we can with their first project, which is really exciting, and all the skills that they learn and networks that they develop are all very valuable, as we hear every year. So please do what you can to help us spread the word. And just a thank you from me and the rest of the team. Thanks to Shrija for delivering it today. Thanks, Awardee, for joining us. And thanks, Ella and Amelia, for helping.